The common symptoms of bladder cancer are blood in the urine, going to the loo more often, needing to go to the loo urgently, and in some cases, recurrent urinary tract infections. The blood in the urine is something that can be very dramatic when it's seen and can settle. It's not a sign to ignore. Even if the bleeding is gone, that's a serious sign, and you should present to your GP or to a specialist as soon as possible. Sometimes there's blood in the urine that we can't see. We call that microscopic or non-visible hematuria. You may come across that with routine checks at your GP where they dipstick the urine in the surgery, or in some cases, there are people that buy home testing kits which may show microscopic hematuria. Again, these need referral to a specialist for further assessment. The way we diagnose bladder cancer is based on a telescopic examination of the bladder and scans. The telescopic examination of the bladder is called a cystoscopy. In the vast majority of cases, our first survey of the bladder is done with a local anesthetic. We use a local anesthetic gel, which helps numb the urethra and also provides lubrication. We then transmit a very narrow, thin telescope into the bladder, which is well tolerated in the vast majority of cases. It takes a few minutes to do. If you feel the procedure is too challenging under local anesthesia, then we can do this under a general anesthesia. This would allow us to review the lining of the bladder and with confidence call any potential masses seen in the bladder that may be a bladder cancer. If there is a mass in the bladder, then we can proceed to a more invasive procedure called transurethral resection of bladder tumor. Here, typically under general anesthesia, we pass a bigger instrument into the bladder through the urethra, and it allows us to sample that tissue, and we can then get a formal diagnosis made by examining that tissue under the microscope. In the vast majority of cases, the bladder cancer affects just the lining, and this treatment, the TURBT, to remove the bladder tumor, removes the entirety of the tumor and provides a clearance of your bladder cancer. To describe the full extent of bladder cancer, we also use scans. This is typically a CT scan and in some cases an MRI. In the vast majority of cases, bladder cancer is detected in its earliest stage and it's imminently treatable. That's why it's important to present with any symptoms early to your GP or to a specialist. Following transurethral resection of bladder tumor, there can be predispositions to recurrence, and for that reason, we keep an eye on the bladder with repeated cystoscopies. We can ascribe a risk of recurrence based on the tissue findings and also the findings of the initial cystoscopy. If you have low-risk disease, then we can do repeated cystoscopies up to a year, and at that point, if you're clear, we can discharge you safely. In those individuals that have higher risk disease, then we need to sometimes consider washes into the bladder of chemotherapy or immunotherapy to reduce your risk of recurrence. The single biggest risk factor for bladder cancer is smoking. If you smoke, you should stop. There's lots of help available from your GP. Overall, the quality of life is generally very good in patients where we catch the cancer early. This makes up the vast majority of bladder cancer diagnoses. After the initial TURBT, there's a raw surface where the cancer was removed. And as this heals, we may see bleeding and symptoms of cystitis lasting up to 1 to 2 weeks. Thereafter, in the vast majority of individuals, the bladder returns to a normal behavior. If you have higher risks of bladder cancer, you may require washes into the bladder to help reduce that risk. These can be irritant and also cause transient symptoms of cystitis, which are typically short-lasting.